Welcome to the Good Horse. I'm Layla. I'm Dolly. And we have Sandra Oxtoby with us today. So, Sandra, can you tell us a little bit about yourself?
Yeah, for sure. So thank you guys so much for having me on. This is my first time doing something like this, so I'm really excited. And I'm very happy that you guys have something like this going on for like kind of the equestrian, dressage, show jumping world in Western Canada, because I'm not aware of any other sort of blog or podcast going on. So yeah, my name is Sandra Oxtoby. I am a Grand Prix dressage rider. I have been kind of involved in the dressage area in Calgary for my whole life. And then the reason why I'm here today, I believe, is because I'm a physiotherapist as well. And my specialty is working with horse riders.
So, like, you treat both horses and the riders. Can you tell us, like, a little bit about how you do that?
Yeah, so when I was growing up, I'll tell you like a little bit of the backstory how I got to doing this, and then it'll make a little bit more sense. So when I was young, my mom had one of the kind of like only international dressage horses in Alberta, which was back in the early 90s, and he got really hurt one day at a show at Spruce Meadows. And the vets were a little bit perplexed because at that time they didn't have like a ton of diagnostic imaging like we do now with like mobile x-rays and stuff like that. And so the vets were like, I don't know what's wrong with him. He's just three-legged lame. And this horse was everything to our family. He was a breeding stallion. So, you know, he really needed to, he basically provided for our family.
Yeah.
So my mom was not satisfied with those answers that the vet gave us of, you know, either we don't know what's wrong, you either have to euthanize, you have to put him down, or you have to turn him out for a year, or you have to put him in a stall for a long time, and we just hope he gets better. She's like, that's really weird. I just went to a human physiotherapist, and I had a really bad bout of sciatica where I was like three-legged lame, right? Like she had this pain going down the backside of her leg. And I went to physio, and in one treatment, I was like 90% better. In 3 treatments, I was all better. Why can't we do some of those tests that like the physiotherapist did on my body? And the vet was like, I don't know. We probably can, but we don't know anybody who does it. So she located a human physiotherapist that also had some training in Europe on horses and got her to come out and assess the horse, and they were able to like kind of find a, you know, not still an exact diagnosis, but we call it a differential diagnosis of like a really good guess as to what was going on, developed him a rehab program, and got him back. He never got back to the same high level of pre-St. George riding that he was doing, but it got him back to like breeding stallion.
Yeah.
I was 6 years old when I watched this whole journey happen, and I knew right away then that was what I wanted to do. I wanted to like take all the knowledge that we have in the human world and start to help horses rehabilitate. So then I went through physiotherapy school, and I thought that's what I was going to do. I was only going to do horses, but then I realized I also really like treating the humans. I didn't think I liked humans that much, no.
Yeah.
But what I realized is that there's like a really big missing piece is that we have like, you know, you have your chiro as a human that you go see in town, or your massage therapist, or your osteo, or whatever makes you feel good. And then your horse has the vet and the farrier and the physio and the chiro. But what about if we like fixed you and the horse together at the same time? Because a lot of the things, especially when we're not necessarily talking injury, but we're talking high performance. So like, you know, in your guys' world, it really matters to your horse if you like go like that and you didn't need to, right? Because your core wasn't strong. So those are kind of the 2 different specialties that I as a physiotherapist have, is like really working with high performance riders on really minute things. Like we work with barrel racers where, you know, everything matters because it's milliseconds of stuff, and show jumpers too. And then we also work with like big injuries, like typical physiotherapy things. So it would be like, okay, I just had an ACL surgery, and now I want to get back to riding at the same amount I was riding before I hurt my knee. Can you help me with that in the saddle? Yeah. It's a really long answer.
Yeah, no, that was awesome.
Okay.
Yeah, that's all good.
Growing up, we did, so it used to be called the Alberta Junior Young Rider Association, AJYR, exactly. So I did that. They helped me go through and go, you know, to my international competitions as a, you know, from basically 14 to 21, because the U25 stuff didn't exist then. So we did that together, and then now it's transitioned into sort of the different, you know, young rider development program.
Yeah, like the development.
Yeah.
Yeah, that's really cool. And she also told me that you did a lot of Western in your time.
Yes.
And I know that makes sense because you're transitioning into reining.
Yeah, exactly. So I did dressage kind of through my teenager years. I dabbled because I always liked to do something fun, right? We talk a lot about how dressage is very like technique based. It's fun to go, you know, do a little bit of barrel racing or do a little bit of reining. But what I say to all the people that I work with, because I'll work with like, you know, a vaulter and then a polo player, and I always compare riding to like hockey versus ice skating. Like, it's just because it happens to be on skates, it's very different. Just because it happens to be on a horse, it's very different. So I think it's very beneficial for me to cross train a little bit. So last year I competed more in the Western dressage world, and this year I'm going to dabble in the reining world. But I say to all of my patients is dressage is the foundation of riding, right? Like, it's just riding. We just take it a little bit more seriously with analyzing it, but it's just learning how to walk, trot, canter, symmetrical, balance with impulsion, blah, 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 blah.
The basic training skill.
Yeah, exactly. Yeah, and a lot of disciplines have never even heard of it, and it's mind-blowing for them that there's like this objective scale of like, oh, I could like check mark these boxes and my horse will be able to come along more faster, just because you're being very systematic about it.
Yeah, 100%. So I know Equus physiotherapy is like has lots of methods. So what technologies or methods would you use?
Yeah, so, you know, as a human physiotherapist, we're trained in school to have a very systematic assessment. So if you come in and say you have a hurt shoulder, we're basically, you know, trained to go through a different series of things. And so what that looks like is there's always like a subjective collection. So it's what you tell me. So how you hurt it. If you say I fell off my horse versus, oh my gosh, it's been going on for 20 years and it's been a slow onset, it's two totally different ways I'm going to treat you. So we kind of collect all the information. Have you had x-rays? Have you had an MRI? Have you seen other practitioners? Collect all that data. And then we do assessment techniques. So we look at range of motion of the joint. What's the strength around the joint? When I palpate it, is it sore? And all of that stuff leads to something we call a differential diagnoses, which is like, okay, chances are this is what you have. You have a torn rotator cuff, but it also could be XYZ. I got to keep that in the back of my brain. So we just take all of those different tools to make a diagnosis. Then when we're doing treatment stuff, and this is both on horse and human, we have different, basically like things that we prioritize in an appointment, in a treatment appointment. The two major things that I want to do with people is, for horses, is I really want to educate, because that's why it's the number one thing in our tagline, is if you understand your injury or you understand how you're going to manage your injury, the research shows your prognosis is so much better. And the second thing is exercise. Physiotherapists are known as like the exercise specialists, and that's what I think is maybe missing a little bit in veterinary medicine is if you have a suspensory injury, it's like, okay, stall rest, but then how do I get them back to jumping the meter 20s? That part is really, really kind of missing of the high performance return to sport. So education and exercise are kind of the major treatment things, and then we have all of our like fancy, flashy tools. I don't prioritize them as much, but oftentimes they're really beneficial. Those things are like shockwave machine, laser, dry needling, cupping, taping, the list goes on. And we just basically kind of pick from what we talk to the owner of the horse about what we think will be best beneficial.
Yeah, that's really interesting. Yeah, that's super cool.
Like, so you have like a list of like different kinds of therapies and like treatments. What would you find like the most effective? Because then the last question and this one's similar, but what would you find the most effective and like, I don't know, quick?
Yeah, totally. So it's a little bit of a loaded question, but I would say, like the most effective is education and exercise, right? Like those are the things, especially I always say to people, like you see me once a week or you see me once a month, doing, you know, shockwave on you will help, but what you do on a daily basis, so if you like change the way you lift or you change the way you sit at your desk, that's way more important. But from the like flashy tool perspective, shockwave has the most research. Because as physiotherapists, we are like a regulated profession. We are bound to be evidence-based, which means I can't just like come up with some voodoo and start doing it on you. Everything I have to do has to have some sort of research behind it. And as we do more research, we may find out that, you know, something isn't as effective as we thought. As a physiotherapist, we did a lot of ultrasound in the 90s, and we still do it. But we've really, in the research, not been able to prove it does too much. The same with K-taping. But I will still use those tools if the person finds it effective. So yeah, shockwave has a lot of research. My number one thing personally is I'm a big dry needler. So I don't know if you guys have ever had acupuncture or dry needling.
My mom and my brother have.
Yeah.
It looks fan of the needles.
Yeah, so not everybody's a fan of the needles, but when you get really desperate, when you've got like a lot of pain or a lot of tightness, it's definitely the thing that can give you like a very good relief, and then you can do your exercises properly. So that's why we talk about the flashy tools. They allow you then to feel better, to then do your exercises or understand your injury better.
So, Sandra,
Yes.
how do you kind of give your clients like knowledge so that they can like kind of understand? Like, how would you kind of teach them on?
Yeah, so a lot of it comes from just like, we call it the therapeutic alliance, but my ability just to talk to you in treatment. You have to trust me, right?
Yeah.
Like any practitioner that you go and see, you have to trust them. So we develop that trust throughout, our explaining of the injury and then what we want you to do. And then it's really about different platforms. Like a lot of people forget their exercises, right? Because they're quite complicated. Sometimes they're really simple, but they're quite complicated. So we use a exercise software called Physio. One thing that I thought would be really appropriate to talk about on your little podcast is that we do online appointments, which is, I find, so beneficial. So somebody sends me a riding video, or their coach contacts me and says like, oh my gosh, this person cannot keep their heels down, and I've told them for 2 years I need some help here. So we watch them ride and then give like a short little video, and then we have an appointment with them where we talk about their injury history, and then I actually get them to do some sort of little assessment techniques, which I'm going to do maybe later with you guys, that tell me a lot of stuff in a very short movement pattern. And then we develop a program that is like, okay, this is your off the horse exercise program, and I maybe also want you doing these exercises at the barn, and that's sent to them in this PhysiTrack software where we've kind of developed horse rider specific exercises, and then they get that, and then it's like in a PDF and an email, so they always have it with them. I say no excuses, you gotta like put it up in your locker in your barn so you see it before you ride, and that really keeps them accountable.
That's super. That's cool.
That's our knowledge translation way.
Yeah, that's neat. Like having an app, that's really handy.
Yeah, totally. Yeah, and they can actually, you can talk back to me in the app. You can give me feedback. And so if you're like, oh my gosh, this exercise hurts so much more right now while I'm doing it at home, but it didn't hurt when we did it in the appointment. I'm like, oh, okay, no, maybe you're like cheating or you're doing a bad technique. Like that gives me information, and then I may adjust the exercise within it. And then I can also make the software like a little bit tricky. I can make you track your adherence, so you need to tell me how much you've done in order to get the next set. But yeah, it's really helpful. Yeah. Because a lot of people just, if you didn't write something down, you'll just forget it when you leave the appointment. And a lot of the stuff, like I said, is pretty complicated because we're talking about high performance stuff. So it's like, oh my gosh, little movements like that matter to your horse. It's not about like, okay, I need to go home and do some bicep curls, which is pretty straightforward exercise.
Yeah, 100%.
So can you tell us a little bit about the importance of having a hands-on therapy, like having hands-on physio?
Yeah, so we're going from online to, so online you still get the benefits of like the education piece, the exercise piece, but then there's a lot of times, like I just did an appointment the other day where it's a brow exercise, she's really struggling with like, getting everything sorted out. And I was like, I think you have to come in and see me, right? Because we need to then assess, like with our hands, we call it manual therapy of like, okay, is is the pelvis level, is there sore muscles that are causing different things? So it's a really important piece, but it actually isn't not always necessary. Because a lot of the online piece, which I think is important for you guys too, because you live in a little bit more of a rural area, is there isn't like fair access to healthcare in Canada, right? Like if you live in a rural place, you don't have the same access to like doctors and sports medicine physicians and chiros as like I do living downtown Calgary. So the online world really expands that. If you live in the middle of nowhere, Saskatchewan, you can still have access to rider physio or horse physio.
Yeah, and I feel like just thinking about like making a mental switch can also help your riding. Like thinking I can't soften my arms, and then someone telling you like, okay, like pull your shoulders back and engage your core, and then you can soften your arms. Just someone telling you can do it.
Totally, and oftentimes the coach has been saying the right thing to them for years, and then we just say it in a different way, and the person's like, oh my gosh, my riding has changed, and I was like, no, your coach said the right thing. It's like when you go to a clinician, and the clinician just says it differently, and that clicks for you, right?
So how do you help your clients like with rehab and like aiming towards what they need?
So rehab we have our high performance things that we help with, right? Like you don't really have an injury, but you just want to like help your coach fix something in you. And then we've got your rehabilitation, which is like you've had major surgery and you need to get back to riding.
Yeah.
So like the example that I used earlier of an ACL, you know, you do your normal physio stuff in the clinic, and I say I don't always need to do that, right? Like my specialty is like, okay, your physio or your chiro or your massage therapist has got you really, really good. I now need to come out for your first ride to get on at the barn, because that will be where we develop your program of, okay, now you want to get back to show jumping, and you have this knee injury. What are the steps to do? So I'll guide you with, okay, we need to actually do leg yields for a couple of weeks. So you're like putting weight through that, and that might not be like a typical exercise that you do.
Yeah.
So it's like exercises within your riding.
Yeah.
Which is super fun.
Yeah.
So being in like the physio field and like being in the equestrian field period, there's a lot of different aspects and different occupations in it, like your farriers, your vets, I don't think there.
Yeah.
How do you collaborate with them and like work together?
Yeah, so collaboration is key. One of the big courses that we take in physiotherapy school is called interdisciplinary communication, because in the human world, it's status quo, right? Like if you come and see me and you're seeing your doctor, communication between me and the doctor needs to be very, very clear. If you're seeing a chiro or massage therapist, I want to know what they feel, because then that helps my treatment. In the equine world, it's coming so well. It maybe didn't exist so much in like 10 years ago or 15 years ago, but now it helps, like, you know, if the vet makes a diagnosis and then they know that as a physiotherapist I'm developing a program and they're approving the program, right? We don't want to do anything without kind of their consent, especially if it's been like a surgical case. And then it's so helpful to have, like, we have amazing equine massage therapists in Western Canada, to be like, okay, can you work on the horse? Because as a physio, I usually only, like, you know, zone in on like, this is what I'm working on, or with a horse, I'm just working on this little area. The massage therapist sees that systemic or that whole picture. So if they're like, you know, it was a right hind injury, oh my gosh, the left neck is so sore. It tells me that horse is still offloading onto that left side. And then there's chiros in the horse world, which I really, really like to also work with the chiros that are human trained and work on horses, because they think very much like me. Because we kind of have like our human brain first, and then we're putting it onto the horses. And then there's all sorts of different kind of newer things, like osteopaths are becoming really, really big, which kind of work more. Yeah, you haven't heard that one?
Never heard of that.
Yeah, so there's osteopaths in human medicine, and now there's some in the horse world where they really kind of work a lot on the visceral system, so like the organ system. So they can, you know, if a horse has had ulcers or something, they can help make that feel better, or a lot of things in the like gelding scars are a really big thing. Mares with a lot of mare-ishness, they take a look at what's going on with the ovaries. So yeah, super cool. Lots of different disciplines coming out, and communication is key. So whether we do letters back and forth, or I'll get the consent of the owner to be like, hey, can I talk to this person about your case? And then, you know, we have that back and forth. It definitely makes the rehab plan go way faster.
Yeah, absolutely.
And trainers, coaches, those are the people that are with the horses and the humans every day. I can't get over how much they know that they just sometimes need a little bit of help of how to get the human to make a little bit of a change, or the horse to make a little bit of a change.
Yeah, absolutely. Yeah, that's super cool.
And I think you guys know too, like I think all of your guys' coaches and stuff are very involved. Like I know you work with Lindsay Stroh, she's a Pilates instructor. Like everybody has their cool little niches, and that benefits so much.
Yeah, it's like all the dominoes falling into place.
Yeah.
So like, yeah, we call it like the wheel, right? So all of your things, all your spokes are all your people, right? You've got your doctor, your horse has its vet, and then you've got your physio and the chiro. And if you don't have, like, the more spokes you have, the stronger your wheel is. As soon as you start to lose, like, if you don't have a great farrier, your wheel is really wobbly. If you don't have a good saddle fitter, your wheel is really wobbly. So taking that into account.
Yeah, that's a good way to think about it.
Yeah, totally.
So, do you have any, like, trends in physiotherapy, like, that you're excited about? Like, is there any upcoming things that you're like, wow, that's really interesting and I want to try it?
Yeah, so in the physio world, there's always continuing education courses that, you know, you want to take and stuff. I currently am on maternity leave. So I have 2 little babies, so continuing education right now is actually like pretty accessible because I have the time, just whether or not I have the energy. But this is an Alberta-specific thing, but we used to be able, but then we weren't able to order diagnostic imaging. Now we are back being able to order diagnostic imaging, so I want to do my diagnostic imaging course coming up January 2024. So that would be like, if one of my riders breaks their ankle, I can send them right from a horse show to the doctor rather than having to send, or to get a x-ray rather than having to send you to a Verge or something.
Oh, yeah.
So I think that'd be really beneficial because a lot of my riders, have back pain and they might need an MRI or something like that. So that's what I'm excited for. So one thing that we've recently pivoted is we were doing a lot. We had an in-clinic location where like riders would come to us, but one of the big barriers is geographics, right? So like you guys live really, really far away. It's not, you're not going to drive 8 hours to come for an appointment with me.
Yeah.
People do when they're really, really desperate. But so kind of this year when I'm done maternity leave, and into 2024, our focus is really going to be mobile. Like we're going to, go to Grand Prairie. We're going to go to Medicine Hat and be right there in the barns with the people. And then really also focus maybe I touch base with you online a few times and then we coordinate a clinic and then come and see you. So that's what I'm really excited for, is to be in the dirt again.
Yeah.
Not in the clean clinic.
Yeah, exactly.
I think a clinic, my mom did a clinic with you a while ago.
Totally.
And I think it'd be super beneficial.
Yeah.
And I would be really excited if you guys came closer to Lloyd.
Yeah, totally. Yeah, so we did a clinic in Lloydminster, I think about 2018, so 6 years ago. And then you and I recently connected in July at Caspian.
I'm pretty sure that was November.
I had a baby, so my months are not in order.
I think that was more in November.
Okay, sounds good. But we did a clinic and we did a super fun lunch hour of where I made you guys do a bunch of movement challenges. So that's like a big social media trend of can you do the different things? And I actually still have some little clips of it, so I'm going to send it to you and you guys can throw it in. So we have a little laugh at her doing some...
The shoe challenge was hard.
Yeah,
totally. Do that one.
Totally. We did the ball on the wall, we did the shoe challenge, we did the squat at the wall, lots of different fun things. And that's something that we go around doing at different pony clubs, hop in for an hour and get basically just, riders aware of oh, look at these are the things that are limiting in my body. I might not notice on a day-to-day basis because chances are you guys don't have a lot of pain with your age, right? No. But if we show you through movement, I have a little bit of a restriction in a certain way, then you'll be able to work on it.
Yeah, 100%.
Yeah. So in this field, you encounter a lot of horse and rider pairs, right?
Correct.
What's the most challenging or unique case you've had that's made you be creative and really think of what is this?
So they happen all the time. There's lots of different little puzzles because usually by the time we're getting called in by the coach or the trainer, chances are they've tried a couple of different ways to fix it and it's not quite happening. So I have lots of cases in my brain, but kind of two different concepts of easier cases are pretty straightforward. But one big thing that we work a lot with is pain in the saddle. Right, so I currently have a little bit of a patient that's stumping me. She has a lot of SI pain that is significantly worse in the saddle, but then better in life, which as a horse rider, that's really frustrating. Because I can feel the frustration in the patient of why does it hurt to ride? I don't want it to hurt to ride. This is my happy place. So that's really, you talked a little bit about the mental component, and that's another spoke on the wheel, right, is having a sports psychologist for yourself, right, and talking through these issues. So those are complicated ones when it's chronic pain, it's not really getting better. Another complicated issue that we work a lot with vets is neurological horses. Right, so this is a really, really big thing in the show jumping and dressage world, is we're seeing a lot more neurological horses from their neck. And it's basically that the way that we're breeding horses, so dressage horses, we want them to have these huge extended trots, and we're breeding them really weird because it's not normal for a horse to move like that.
Yeah.
So neurological cases we're getting called in, and then it's really just a really hard conversation of, is this horse safe to rehab, or is this horse not going to be safe for that person to ever ride again? Yeah. Those are really, really tricky things, and oftentimes we try and we do a lot of groundwork and see if the horse can get better, because humans have neurological symptoms all the time, right? Somebody can have neck pain and it causes numbness and tingling down their fingers, but horses stand on their fingers, right? So if there's any weakness or numbness, they can't communicate that to us, and we never want them to fall with their rider or things like that.
Yeah.
Yeah, so that one's tough.
So, getting on the bright side,
yes,
what would you say is your pump-up song?
Ooh, that was not in the list of pre-questions.
No, we ask everyone though.
Oh, okay. I did listen to all your episodes. Pump-up song. Black Betty.
Ooh, yeah, that's a good one.
Yeah, so I used to play lacrosse because I also think that's a very important thing to do as sports. Exactly, other sports. And one of the things that we always say to people is like, I want you to try and do some sort of sport that's different than riding. Right, so like we always talk about racket sports are really good because there's a lot of rotational stuff. So lacrosse is really good for that. Hockey, snowboarding, because riding is very much like this kind of sport.
Yeah.
So it's good to cross train. But that was my pump up song for lacrosse was Black Betty.
That's awesome.
Yeah, totally.
Yes.
Anyway, thanks for coming on and talking to us.
Yeah.
I had such a fun time. I love talking to you.
Perfect. Yeah. No, I'm glad that we timed this with you guys coming down to the AEF, banquet. It's always much better to do stuff in person, but like we talked about online, Zoom, all the different podcasts you guys can do will be super fun, and I'm really excited to subscribe and to listen to them all.
Mm-hmm. Yes, and I hope it's really educational for you guys too.
Sounds groovy.
Sal.
Head nibbled on.
Oh, I don't know.
Oh, okay. That makes more sense. Yeah, so if somebody has an injury and they, say they have a surgery, they tell their doctor, yeah, I only have an unbroke 2-year-old. That's not the first horse to get on after having a surgery, right? You want to ride like a really safe schoolmaster. So that's what he is for me. I've had people who've had hip replacements and they want to like swing the leg on a bunch of times. He's that guy. Okay, we'll go grab the stirrups. Too much. Versus you said you were 5'7". Alarm check and see if that seems like it'll be too long. Because I'm 5'2" if you're only 5'1 and a half.
Sorry, I'm used to.
The hardest part is when we do the riding assessments, you're not usually learning to ride a new horse as well as change a bunch of things. Recording. Good. Okay, so tell me about what your issue is in the saddle.
So I curl my whole left side curls up.
Okay.
And I collapse through my left rib cage.
Mm-hmm.
And I've injured my left knee snowboarding. I sprained my ACL and my MCL.
Mm-hmm.
And then I injured my ribs.
Okay.
We thought we broke one, but
Yeah.
I didn't.
Okay.
Well, we don't know actually.
Yeah.
But my ribs are sore sometimes.
Okay.
And then I just tend to
Do that.
croissant to the left.
Okay, yeah, your little arc. So what we're going to do today is a little preview as to what we do in some of the riding assessments. So anybody that when they're riding tips forward, collapses to the side, or does a weird rotation, benefits from these bands. So we're going to put the bands on. You're going to wear it from one shoulder to the opposite heel, and that shoulder to opposite heel. So the bands make you find perfect center. Because if you do this, which is your tendency to collapse, you're going to push into the band on that shoulder, which you're not going to do. That band is resisting you. So it's going to hold your shoulder down. So then it allows your body and the bands to feel center. Because oftentimes we get so crooked that crooked feels normal. Right? So we just need this little tool to help us see what is center. And then we take the bands away and then see if you can find it again. Mm-hmm. Okay? So let's do that. We'll pop the bands on. So this is a whole learning curve for you because you got a new horse, different saddle, different boots, different everything. So it's just going to be about walking and feeling your body. And when you come to physio appointments, it's often about those little things, right? So put that up over your helmet.
Like this side?
Like that, yeah. And then this goes down under your heels. Right?
Oh.
Does that hurt?
Yeah.
Well, does it hurt those ribs?
Yeah.
Makes you clap. So let's put the opposite one on, which is going to even you out. How long ago was your rib injury?
A month ago.
So it's still pretty new. Most rib injuries, there's not actually much we can do except for let them heal.
Yeah.
6 weeks, you should be pretty pain-free. If it's beyond 3 months, then you would just want to actually go for an x-ray. Yeah. But you probably just landed really hard, right, snowboarding?
Yeah, I caught my entire front edge.
Yeah.
And then I went face first into hard pack.
Yeah, totally. Yeah, not ideal for your riding.
Not ideal.
Okay, so how's the pain in the ribs here?
Better.
Okay, so we always talk about it in a pain scale. 10 being the worst pain you've ever had, 0 being none. What would you say it is right now?
Like a 1.
Good. Yeah. So a 3 and under, we're usually like, okay, let's work with this. If you were like, it's an 8, then we would not put the bands on because the bands are squishing it too much, right? Okay, this is going to be really weird. You're just going to go for a walk. Just go kind of loose rein. Has nothing to do with him today. It's just about you feeling your body. Okay?
Oh my goodness.
Here we go, buddy. Come on.
Sorry.
There we go. Just go for like a little walk, like kind of have your eyes on that poster. He loves to follow me like a dog.
Aw.
So, the bands are going to pull your heels up. I want you to still keep a long, effective leg and give him a kick. Yeah, there you go. He's testing you, right? There you go. He likes to just see if you like mean business or not. Good, and then just come down the wall here. How's your pain in your ribs? Good. Okay, nice long heel. So the band is really helping you find that elongation. If you give into the band, obviously your heel is going to curl up, and that's why the bands are beneficial, is it really helps you kind of find that, elongation is the right word.
I can feel my quads working.
Good. And both of you guys suffer from knee pain, right? So having strong quads is really important.
And we took him to the chiro and his sacrum was out to the left.
Oh, there you go, yeah. But the question is, did you cause his sacrum to go out to the left because you were collapsing? Right? It's always the chicken and the egg.
What we're trying to figure out.
So now change direction. Are both your quads burning equal?
My left one's burning more than my right.
Okay, so these are the things, right? Like, okay, that weakness is coming out with these bands. Good, so elongate that heel again. Because he's more woe than go, you have that tendency to be like, come on. And that causes like our legs to shorten and contract. There you go. Good, and think about just like walking as fast as you can. You're really gonna cover ground. You're gonna find quite a bit of relaxation in your pelvis, which is a big thing we really work on because your pelvis is your biggest area of talking to the horse. There you go. And then drop that heel and swing with your seat. So you're gonna march them with your bum. Boom, walking. There you go. Yeah, you're in dressage. It's so important the judge can't see what we're doing, right? So they can't see you moving your pelvis, but they can see you moving your legs, right? You're like, I'm trying so hard not to.
I am dying here. Holy cow.
I know, right? Okay, is it still the left quad that's burning more?
Yeah.
Okay. Okay, let's pop off the bands now because the most important part is what you feel after wearing the bands.
Yeah, it's making my left shoulder
Hurt? Sore. Okay. So all these things tell us different information that we would then design you an off-the-horse riding program to strengthen in the saddle.
You want me to pull these off?
Yeah.
Wait, which one do I need to?
There you go.
So for different height of rider, you just use a different length?
Totally, because like these ones would be so tight on you, where you would be like, because you feel that tendency, right? The band's pulling your leg up, and your leg's like, I want to get him to go faster, but you have to kind of like elongate, right? And yeah, totally. Does that make sense about your bum?
Yeah.
That you want to like really walk with your bum. And on horses that are more sticky, we're like, come on. But it's okay to use your leg. You give them a kick, but then you go right away to elongation because you don't want to get tight through here. And sticky horses make you tight. Okay. But that's why I always say this is his job, right? He kind of like pulls the stuff out. If he was a really, really fast horse, he wouldn't make people feel comfortable, right? He just makes it hard for people.
Yeah.
So pretend you have those bands on, that it's almost holding your right shoulder down. So a lot of times when we have a problem, like you have a left-sided problem, we try and fix the left side, but oftentimes we can actually fix it by fixing the other side. So that would be my big thing for you, is just think about a little bit that your band is not letting the shoulder creep up on the right. That'll give you more space for those ribs too.
Are you mentally prepared? I'm mentally prepared.
That's my suggestion to like you guys or any, equestrian that really wants to pursue the field, is like get your bum in the tack with as many horses as you can. Because we go, when we ride our own horse, we don't see necessarily the little like flaws and stuff. When we have coaches, they help us see them. But yeah, if you can ride as many safe horses, I don't always suggest being like, oh, I'm going to go ride every horse. You got to make sure it's safe because you never want to be injured, right?
Every time I would like squeeze,
Yeah.
so like when I'm squeezing, it's like the knee, it's like a tiny sharp pain almost on the
Here, let's go over to that side and you can point to where the pain is.
It would be like a sharp pain almost in this line.
Okay. So it's actually really exciting that it's on the outside. Like, joint pain that's within the knee is kind of mainly like all through here in the joint line. This, often could be your IT band is really, really tight and it's pulling this kneecap outwards, and that's that instability that you feel.
So a weird thing is like after I'm done riding
Yeah.
or like at the end of the day when I go to bed, it's so painful, like aching in here.
Okay, so the delayed pain is in here. So this is all the more reason why while we're doing the activity, we get the pain here. This is the pain I want to deal with.
Yeah.
This is like the referred pain where maybe your quads are working really, really hard to try and keep this kneecap nice and aligned.
Yeah.
But yeah, this would be my goal. So basically you guys both sort of have the same-ish thing, right? Yours is a left knee, yours is a right knee. So you're off the exercise, it'll be very similar.
Yeah.
And does it hurt right now when you activate it? When you apply that leg?
Now it's not bad.
Okay, so 0 out of 10, you don't feel it at all. Okay, so let's do the bands on you. So pop that one up on the opposite shoulder. There we go. And here. Ooh, you're tall. Okay, we're gonna make you work hard here.
Kind of feels like a nice securement almost.
Yeah, so kind of feels like you're really like pulled together, right? And that's why that elongation down against the bands is kind of a weird concept.
Yeah.
There we go. Okay, so same thing, just do like a walk lap either way and tell us what you feel. Like, she felt that really weakness in there. You might feel it like in a shoulder or something. So yeah, same thing, right? You see the heels come up, there's the snow. Just drop your heel down into the band, and then as you do that, you want to like not get tight here. So if you have pain with activating and applying your leg, we actually really want to work on relaxation with you, and then maybe you can activate your horse a little bit more with your bum.
Yeah.
Okay. Good. And then let's change direction. What do you feel going this way?
Hip joint would be, it like gets sore almost.
Okay. Okay. Only on this side.
It's a little bit more on this side.
Okay.
But all from the
Okay. And that's the other interesting thing we often see is like where there's a problem, like say the knee, we then can get this like secondary pain at the hip or the ankle or the shoulder, right? And that's why I was like saying, ooh, we really got to pay attention to where the pain is when you apply the activation and kind of not the delayed pain, because the applied activation pain is probably more the true pain. We have lots of fake pain, right? Or secondary pain or compensation.
Yeah.
Okay, so what do you feel with your hips this way?
I'm not squeezing as much, but it's still the outside that kind of lingers a little bit.
Okay, perfect. So then just come to a halt and we'll take off the bands and then we'll see if that hip pain instantly goes away or if it's
There's one, two, there's two.
okay, change direction. So how do those hips feel?
Still like almost the same thing.
Okay, same as when they were in the bands?
Yeah.
Okay. So due to your knee pain, we would probably give you some hip stuff too.
Yeah.
I'm really both of you guys. Oftentimes people get confused when you go to physio for knee pain. We actually often really focus on the hips. It's not that we're ignoring your knee pain. It's that the hips stabilize in walking. So if my hips are weak, I end up kind of walking like this, which puts a lot of torque on my knees.
Yeah.
So if I get strong hips, my knees take less torque. So that's why we really focus on hip strengthening. Asymmetries.
Yeah, it makes a lot of sense.
Yeah. So the bands don't make you fight yourself, right?
Yeah.
So if you're leaning, then you won't do that in the band, or if you're, tipping forward, you won't do that in the band. So we only wear them for like a few minutes, and then I would do like a full lesson after we have those bands.
Oh, yeah.
Okay. So both of you guys have knee pain, and this is one of the most like functional exercises that we give riders. So it's called wall squats, and it really helps you with like your rising trot and helping finding your seat in the saddle because it strengthens your glutes, which oftentimes is involved in knee pain. Okay, so she's going to demo this because she actually already knows this one from a clinic that we did. But come close to the wall, so you can be like about an inch away with your toes, and then you want to be really wide, like you're on the horse. So all the how wide's your horse? So a lot of the exercises we do, we try and recreate being in the saddle. Okay. So what you're going to do is you're going to squat down as far as you can and stay nice and upright, so kind of looking. And then you squeeze your bum cheeks to come back up. Okay? So flex at the hip and go down. And then squeeze the bum cheeks to come back up. So it's that brain's awareness of the bum to push yourself back up that you feel the burn right away. Especially because we're going so deep, right? Obviously, if you had pain during this exercise, you then would let your physio know and we would tweak it. And or you would just see like, oh, does it get better if I do a couple of them and that pain goes away, or does the pain get worse? That's how we switch the stuff up. Okay, so you guys have your exercises.
Jolly's turn. Get over there.
All right.
Okay, so inch away from the wall, a little bit wider. There we go. And we may change your guys' squats because you guys have obviously very different lengths of your femurs, right? Mm-hmm. So oftentimes there'll be different tweaks with how you do it. So we'll just see how you do yours. So just kind of go down as far as you can. Good. And then squeeze the bum to come back up. Squats are such a great exercise because it's functional. You do this kind of stuff all day long. Mm-hmm. Squeeze the bum back up. Good job. Does that hurt your knee at all? No. Good. So then you keep doing it, right? But then if in 2 weeks your pain's getting worse, you'd be like, oh, is it squats or not? You're always tweaking and listening to your body.
Yeah.
Okay.
Awesome.
Thanks for watching the GoodHorse Podcast. And make sure you tune in next time. And thank you, Sandra.
No problem. Thank you guys for having me.
Yeah. Awesome.
See you guys.